And so we have sort of carried on with those 7 developmental domains then to apply it to how we think about a child's development and what we see on the outside in terms of their behavior. What are we observing in the child in terms of their functional abilities? Now, one of the things that we want to talk about is how how the brain is organized and how we can understand behavior based on this sort of complex trauma lens. So in this particular slide, we've got a triangle here, an upside triangle, which is meant to represent the brain. So you can imagine the brain sort of sitting in your head as an upside down triangle here. This is the way that your brain develops from the bottom up and from the inside out, to quote Dr. Bruce Perry. And the idea is that the survival brain is the first to develop. That's the part that keeps your body systems working, your heart pumping, your lungs breathing. It keeps your chemical levels consistent in your brain and in your body. And then on top of that grows this limbic system, this part of the brain that deals with emotions and relationships. Later, the last part to develop is kind of the thinking part of the brain, the logical part of the brain. So in a fairly mature brain, which this is meant to represent, if we looked at someone's behavior and we tried to understand it, and if our belief was that the logical part of the brain, the thinking part of the brain, the rational part of the brain was kind of driving the behavior, if it was in charge, then what are some of the assumptions that brings to us about what we might do to intervene? So for instance, if we think that the logical, thinking, rational part of the brain is in charge, then we might spend more time talking to a youth or child whose behavior is difficult. We might think that if the logical part of the brain's in charge, then we can reason with them. We can talk to them, and that ought to change their behavior. Another thing that we might apply is the idea of consequences. We might think, this child knows what to do, they're just not motivated enough to do the right thing. And so then what we might be doing is to be applying consequences, positive consequences, negative consequences, with the aim to motivate him or her to do better. Now, what if we saw the brain differently? What if we took this understanding of complex developmental trauma and we saw the brain of many of these children that we work with as actually being a very immature brain and more representative of that the brain is actually organized and more along the lines of this image on the right, where instead of being the upside down triangle, it's actually just a triangle, that the lower parts of the brain, the survival part of the brain, with all of that practice of being on high alert, of dealing with stressful situations, with that smoke alarm detector of the brain ready to go off at the slightest whiff of potential danger, and then the emotions of the child in a bit of turmoil around attachment, around other kinds of issues, having an impact. But the logical brain being poorly developed, logical, rational, language part of the brain being poorly developed at this point. If we looked at that child and we tried to explain their behavior, we could see that their behavior is actually being driven by these lower parts of the brain, the survival part of the brain. And that as they go through the day, when we see behaviors coming out on the outside that are challenging for us or difficult for us, issues in social relationships, issues with controlling their temper, issues with controlling their impulses, if we looked at the child more through this lens, we'd be less inclined to be talking to them or to be using motivation systems, because we'd realize that logical part of the brain is not actually the part that's driving the child's behavior. It's not the part that's in control. The part that's actually driving their behavior and is in control is that survival part of the brain. So we would approach this quite differently, wouldn't we, in terms of stepping in to intervene with this child or this youth. If we viewed it this way, we might think that our main task is to quiet the survival part of the brain. That we would want to help to quiet the emotions. And it's only when this child got to a place of being more quiet and calm and their brain sort of settled more back over to looking like the brain on the left, that's the time when we could step in with some reasoning and talking and to the child. Dr. Perry's group has been talking about this as your job being to help the child to regulate first, that's that survival brain, quiet the survival brain, and then to relate to them. Although those two go together a lot. Lots of times we're using our relationship and the relating to the child and empathy to help them to quiet and to calm. But the rational part of the brain, the reasoning, the talking part, doesn't come till much later when they're